morning. My name is Shirley and I'll be the student nurse conducting your health assessment today. Would you like me to call you George or Mr. Pham?
No, you can call me George, that's fine.
Okay, wonderful. Nice to meet you, George.
Nice to meet you.
Okay, so as part of the health assessment, I'll be taking down some notes. Is that okay?
That's fine, don't have a problem with
So
that.
I've got your consent to do that?
Yes, yeah,
Excellent.
my consent.
Now, would you like a glass of water before we start?
No, I'm fine, but thank you.
So you feel comfortable at the
Yes,
moment?
yes.
And how about an interpreter? I can also arrange that.
No interpreter required.
Okay, so I'll just go over some details to confirm your identity. So your full name, date of birth, and your address, please.
Yeah, so full name is George Pham.
Mm-hmm.
Date of birth is 17th of January, 1946.
Yep.
And address is 52 Homebush Street,
Yep.
Central, and postcode 2001.
Okay, 2001. Okay, excellent. So all that matches up. So, do you have any allergies?
No allergies that I'm aware of, so nothing on record.
Okay, that's good. So, what concerns do you have that brings you here to see me today?
So I have stopped smoking for about 42 years now.
Mm-hmm.
I did average about 20 cigarettes a day, so
it's quite a fair bit.
it is quite a fair bit. So now that I've stopped, I have noticed for the last 5 weeks I built a cough off and it hasn't gone away. So I'm just a bit concerned, and that's why I'm here.
Okay. So I can see that you come from a Vietnamese background.
That's correct.
And how long have you been in Australia for?
I've been in Australia for about 42 years now.
Okay.
And then, so it's been quite some time. So I'm here with just my daughter and her 3 kids. So when we did come to Australia, my wife passed away 5 years after arriving from ovarian cancer. So it's been quite tough.
I'm sorry to hear that.
Yeah.
Okay. Well, can you tell me a bit about your lifestyle at the moment? What's your daily routine like?
So at the moment, I do a morning shift. I'm a baker. So from there, after I finish work, I do help my daughter as she goes to work. I do look after her 3 kids, and I generally just sometimes I take them out to the park, and as soon as she finishes work, she'll take the kids back. Yeah.
Okay. That sounds like quite a busy lifestyle you have there.
That's right.
Like a full-time job.
Full-time
Working
job.
and then taking care of your grandchildren.
Yeah.
Yep. So how often do you actually get to sit down and have a proper meal? And what do you usually eat?
So I try to cook a little bit, but generally like I cook a bit of fried noodles, fried rice, but I'll generally get a lot of takeaway food from the Vietnamese cafe or club. That's my daily routine.
Okay. Well, did you know diet can really affect your body?
No,
Okay. Well, for example, fried food especially is not healthy because it contains a lot of fats and oils, and this can increase your blood pressure and cholesterol, and really all these are risks to heart disease. So I would, recommend for you to avoid that. Okay. So since you're so busy with your lifestyle and you don't really have time to cook often, have you heard about companies such as U Foods and Muscle Chef?
No, I haven't.
Okay,
I've never heard of them.
so these are companies around that make healthy pre-made meals. So with these companies, they cater for different diets such as keto, vegan, vegetarian, low carbs. It depends on what you're after.
Right. Okay.
And they average for about $10 a meal, so that's pretty much what you'd spend on takeaway, would you say?
I would say that's correct. That's about right.
Okay. Yep, so these are healthy. They have everything that you need from the food pyramid, so not just fried foods, which is not good.
Right.
Yep. So alternatively, when you go out to buy food or takeaway, you could just buy more fruits and vegetables instead, or just look for healthier options.
Okay.
Yeah. So also, do you drink any alcohol at all? How many standard drinks would you say you have?
I do drink. I have about 3 to 5 drinks a day, and that's spread out through the day as well. So that's what I'm averaging at the moment.
Okay, well that's quite a bit.
Okay.
So, according to the Australian Health Guidelines, it's recommended that you drink 10 standard drinks per week and no more than 4 standard in one day or one sitting.
Okay.
Okay. So drinking any more than 2 standard drinks per day can really affect your overall health. Do you know much about the long-term effects of alcohol?
No, I don't. Can you explain that to me?
Yeah, so it really harms your body, okay? So excess alcohol consumption on the body can increase your risk of diabetes, cancer, heart issues, and high blood pressure, as well as liver failure. So I'd recommend the less you drink, the better, and other alternatives like drinking water, juice, preferably not with a lot of sugars, and other things when you, so non-alcoholic things when you go out. So you mentioned you recently quit smoking. Can you tell me more about that?
I have. I've quit smoking, and so I haven't done anything else but besides quit. So would you recommend anything that I can use or any services maybe help?
So there is Quitline, which is a support group which can help you. I can give you the details for that. And I'd also recommend nicotine patches to help with any cravings, because since you've made the decision to quit, which is excellent, we don't want you falling back into the same pattern of smoking again, because it is a hard habit to kick.
Right.
Okay, so how do you incorporate exercise into your daily life? Would you consider yourself active?
I would consider myself active. I do take the kids to the park when I'm looking after them, just to help take them out and have them out and about. Besides that, there's no exercise or anything I'm actually doing besides just walking around with the kids. So that's probably my day-to-day lifestyle there for you.
Okay, well, I'm glad you do get out, and that sounds moderately active. So it's actually recommended that you at least get 2.5 hours of exercise in per week.
Right.
So you need some physical activity, which gets the blood pumping and gets your cardiovascular system working, so it maintains its healthy status. So you can just consider walking more often. So maybe if you walk to work, or you're doing more brisk walks with the kids at the park. And have you considered maybe taking up some extracurricular activities? So maybe Tai Chi, or if you can do some push-ups or a little bit of jogging while the kids are at the park, since I know you don't have a lot of free time.
Okay, I'll put that in consideration.
Yeah. Okay. Another thing I can do is I can recommend you to see an exercise physiologist. Would you like me to give you the contact details for that?
That'd be great. That'd be great if you could, please.
Okay, excellent. So do you wear any sun protection at all when you're outside?
No, I don't wear any sun protection. I tend to take the kids to the beach sometimes as well, but I don't wear any sunscreen of any sort.
Okay.
I don't wear a hat or anything like that.
Oh, okay. Is there a reason why you don't wear any sunscreen?
I don't know. I've just never wore it.
Never burned?
No, never burnt. I just get darker.
Yeah.
Yeah.
Okay. Well, it is recommended that you wear sunscreen. Do you know much about what happens to your skin after a lot of exposure to the UV rays?
No, I don't. No.
Okay. So, overexposure to sun damages your collagen fibers in the skin, and this accelerates aging. Also, it increases the risk of skin cancer, such as melanoma, which is not good.
Okay.
Okay. So, I'd recommend you always wear a hat, sunscreen, and glasses. And also, if you could be a role model and also encourage your grandchildren to do the same, I think that would be a really good idea.
Okay, I should do that.
Okay. Now, I think that's good for today. Are you interested in having another follow-up health assessment to see how you're going?
That would be great if you could. If you can book me in, please.
Okay, well, thank you for coming. If you need any further assistance, don't hesitate to contact me.
Thank you. Appreciate it.
I wish you all the best with your health.
Thank you.
Nice to meet you.
Nice to meet you.